We have today Rosemarie Maldonado, who is 39 years old. She's been a patient of mine for 3 years and has been on testosterone replacement for 2.5 years. So actually you were about 36 when you started taking testosterone, right?
I was 36.
Okay, so what was going on, what was bothering you that made us look into this question of whether or not you had adequate testosterone or not? What was bothering you?
No desire for
No.
sexual encounters.
No desire.
I felt fatigue. I felt like something was wrong with me.
Sexually, you mean?
Sexually.
It was your fault.
I felt like it was my fault and my partner. I felt like I wasn't satisfying my partner. And I just didn't feel comfortable.
On the sexual part, you also had some discomfort with sex at that time.
I wasn't as lubricated as I should have been, or could have been.
As you were before.
As I was when I was younger.
So there was less desire for sex, it was uncomfortable, there was less lubrication, and what about the satisfaction from sex? Was that there, or had that changed also?
No, that changed. I wasn't satisfied. And I was just more or less doing it to satisfy my partner, but I knew something was wrong.
In regard to the sexuality, you had sought some medical advice?
I went to my gynecologist and I had explained to her what was happening, and she had thought, maybe because I was under, stress with my relationship at the time, that it was probably nothing, that some women just go through this. It's just stages. So she did, a few tests, and she said that everything is normal and that there was nothing wrong. So I just continued to function on the whole the best I knew how, and I was uncomfortable.
But it didn't get better?
It didn't get better.
Was this fatigue something significant that you were tired? Were you tired all the time? Was this affecting your life?
Tired, depressed, anxiety.
A lot of depression, a lot of anxiety?
A lot, because I felt like I always had to perform, but not up to my standards, not up to the way it once was. My partner would say, is there anything I could do to make it better? He used to blame himself, and I used to explain to him that it was just me, and psychologically, I was in pain, so I would avoid different encounters, and I wasn't as confident.
Well, when would you say in your life that this all began? We discussed this when you were 36, so for how long had you had this problem, these problems?
I would say the early 30s. Things started to go downhill after 30. I started feeling differently.
And was this getting progressively worse, all of these things?
Yeah.
The fatigue, the lack of sexuality, the discomfort, the anxiety, the depression?
It was getting worse, and it felt worse than it was biologically, until the test came back that I had no testosterone at all.
And at that point we started you on replacement, and what happened?
Started feeling much better. Took a couple of months, to get the right, level for me.
Right.
And I felt more confident, and I was able to have more orgasms.
The lubrication returned?
It returned.
And so the orgasms got better?
I feel more confident, yeah. I feel like nothing is wrong now. Now I'm where I'm supposed to be. And I even went to an endocrinologist and just made sure that the levels are what's proper for me. And they said, thank God your doctor found the right dose for you. You're not too muscular. And I'm glad to see that, you're feeling better.
Oh, very good.
And he said, why wouldn't you come to me first? I said, because I was going to my gynecologist, and I just thought that it was something that I was supposed to be experiencing for my age, so I want ignored. Until I discovered you, and I was able to sit down with a doctor who understood more than, just being a patient and ignored.
I'll say to those watching you that it is something that you're supposed to experience with your age, but it is because of the loss of testosterone, and it doesn't have to be, because this loss of testosterone is a disease like any other hormone loss disease, and every woman should be treated. You said that the anxiety and the depression went away. Did it go away completely or just get better?
Just got better. I think completely. I have no reason to be depressed. I'm more confident and comfortable in, encounters with my partner. I have a lot more energy. It actually sped up my metabolism. I lost weight as a result.
You lost weight?
My skin is tighter.
This is not something new now. You've been on this for 2.5 years.
And I feel much better.
And it's still working well.
Still working well. And we're still testing it to make sure that I'm getting, you know,
The right
what I
amount.
need every...
Have you had any side effects?
In the beginning, I had some hair growth, you know.
And what happened with that after a while?
A few hairs underneath my chin, but nothing where it was so obvious.
And
It went away.
any hair now?
No, just the normal, you know.
Mm-hmm.
Lip waxing and eyebrows.
What would your recommendation be to other women who are experiencing what you experienced?
To get tested. To get tested. And if they weren't sure, be sure. Go to your gynecologist. Come to Dr. Gordon. I'm always giving you new patients, so you can't retire. And now I sit back and I tell my gynecologist, you know, just how I'm feeling. I'm feeling much better.
And what does she say about the testosterone replacement?
She says good. She says, you know, if this is what makes you feel better and you feel better, you know, the woman has to want to do this. Some women think that, you know, there's no need, you know, and I think that's total ignorance. Because when I sit across and I try to advise my mom, she's very old-fashioned and she thinks that women are not supposed to have testosterone. So there's a lot of myths.
The thing about the testosterone deficiency disease is that the sexual part of it is the least important. As important as it is, it's the least important. And all of the other health aspects of testosterone deficiency need to be addressed much more than the sexuality. But anyway, we're successful with you. I'm glad to hear.
I'm glad we discovered, you know, that there was a problem and that I, you know, wasn't all in my head. So along with feeling better and enjoying encounters, these are justice.
Okay, well, my pleasure. Thank you very much for making the video.
You're welcome.